I'm Dr. Jennifer. Today we're going to show you a little bit about what we do on kids and how we adjust kids and the reason for getting kids adjusted. First of all, probably the most common thing that we see kids for is for ear infections. Parents need to look for tugging of the ears, fever, runny nose, and what we're going to do is usually we see kids 3 to 4 times. After that, we usually go to a maintenance plan, and you'll notice a difference after that. The other thing we see kids for is for colic. With colic, we like to check the neck area for tightness. You know, you'll see your kid leaning one side or the other, and they don't like to turn their neck very much, or stomach pain. With the stomach pain, you'll have the constipation and stuff like that, and that will also be affected by the low back. The other common thing we see is with acid reflux, which acid reflux is going to be through the mid-back. That's going to be where you see kids spitting up more commonly, can't lay flat, have to be tilted during sleeping. So what we're going to do is we're going to kind of show you a couple of areas. This is my little boy Jet, so Sarah's going to come in and help hold him while I kind of show how a kid would be adjusted. Luckily Jet's sleeping right now, so maybe. So what Sarah and I both kind of do is we kind of run our fingers along the spine, and this is something you can do at home to know if your kid is out of place. What you'll do is kind of take your 2 fingers, have the spine freely open, and just kind of drag your hand along there, and when it gets to be an uncomfortable spot for the kid will actually wiggle and try to get away from you, and that's, you can know that that area is tender. That's a good way of checking. Another place to hold and check is right above the diaper line. You're going to hold here, just like where he doesn't like that. I haven't adjusted him in a couple days, but just so you can see him wiggle. So that means where he wiggled, he was uncomfortable. So what I'm going to do is kind of show you that area of adjustment. Usually we have the mother hold them so they're more comfortable getting adjusted. And what you're going to do is just hold. What I do is just hold in the area, and they'll kind of move. And kids actually adjust themselves. They kind of rotate away to get the vertebra to go back into place. So there we go. And then the other area of common is the neck. Basically what you can look for here is when you rub on the neck, they're gonna again try to get away from you. It'll be real tender to them, just like it's tender to us, it's tender to them, so they'll kind of pull away from you. And then adjusting the ears, I usually do that. We won't do that because they do cry a little bit. It's just a little bit of a shock to them, but I like to show usually the parent how to what it feels like to have their ears adjusted, just so they know what the child is about to experience. So I can show you on Sarah. There you go. And that's what you do. And what that does is just open up the ear canal and lets them be able to hear and let it drain. A lot of times after the adjustment, kids will notice the clearing of the nose, a cough and stuff, just as long as it's not a green, like a sinus infection. And that's it. Anything you want to add?
Most of the time whenever you get your babies adjusted, you notice immediately a difference in their sleeping patterns, and that seems to be the most important thing to the moms that we see in our office.
That's it. Thank you.